welcome to another episode on our Healthcare Hub GA233. We hope you had an interesting time watching our previous episodes. Thank you for liking, commenting, and sharing. On today's episode, we are going to discuss about Parkinson's disease. Did you know that there's a global increase in the number of deaths and disability among people living with Parkinson's disease? Did you also know that the two major drugs that have been proven to effectively manage Parkinson's disease is either not available or not affordable in a low-income country like Ghana? Although we are facing all these challenges, people living with this condition could live a normal life in our rehabilitation centers when they are managed effectively. However, how many rehabilitation centers do we have in Ghana? Parkinson's disease is a brain condition. Your brain progressively damaged and your symptoms get worse over time. What we often see among people with Parkinson's disease is muscle tremors, muscle stiffness, difficulty in swallowing, depression, anxiety, and impaired balance and coordination. Which group of people does Parkinson's disease affect? It's naturally age-related, and averagely people above 60 years stand at a higher risk of developing Parkinson's disease. Although there can be early onset, those are mainly hereditary factors. That means if someone in your family has developed Parkinson's disease, you stand at a higher risk of developing Parkinson's disease early. So what causes Parkinson's disease? The only proven or confirmed cause of Parkinson's disease is genetics. Although people who are often exposed to pesticides, such as our farmers, they stand at a higher risk of developing Parkinson's disease. And our welders who work with metals, the welding fumes make you or predisposes you in getting this condition. And people living in overly air polluted areas, they are often exposed to toxins and they stand at a higher risk of getting this condition. So what brings about Parkinson's disease? Every normal human being has a portion in our brain called the basal ganglia. What they do is they send signals across your muscles to be able to move. Also, there's a chemical messenger in your brain called dopamine. People with Parkinson's disease are not able to produce enough of this dopamine, and this often leads to the symptoms that they experience, such as the muscle tremors, stiffness, and difficulty in swallowing, etc. Nevertheless, people with Parkinson's disease don't only experience muscle challenges. They are nerve endings that carry the chemical messenger, that's the norepinephrine, is also affected. And the function of the brain that controls the blood pressure and your heart rate are tempered with. So they often get a sudden drop in their blood pressure and they start feeling dizzy, and then they might even fall when they are in a lying position and they try to get up, or a sitting position and they try to get up. What are some of the symptoms that we see among people living with this condition? About 80% of people living with Parkinson's disease exhibit rhythmic hand shaking. You see that their hands keep shaking even when it's not in use. When they are picking objects, their hands will be shaking. When they are moving, their hands will be shaking. And if they are even staying still, their hands will be moving. And then one cardinal sign that we use in the diagnosis of Parkinson's disease is the bradykinesia. That's the slowed movement. They are not able to walk as fast as normal humans do. So when you visit the clinic, when you exhibit this unusual movement, your physician or general practitioner is able to diagnose you that you have Parkinson's disease. And they also have impaired balance and coordination. That's why we often see or hear falls among people who live with this condition. They end up falling in their bathrooms, in their halls, etc. because their movements and balances and coordinations are impaired, and they don't have control over their facial muscles too. So although people living with this condition would like to exhibit some feelings of maybe anger, happiness, etc., their facial muscles is so stiff that they can't even smile. So some of them are often abused by their carers or caretakers because they can't even show you that they've been abused or they've been hurt in a way. They also have difficulty swallowing. Most of them have erectile dysfunction, especially the men. They are not able to erect as normal men do. All this occur as a result of Parkinson's disease. So how do we diagnose Parkinson's disease? Ideally, a neurologist preferably would have been the best candidate to diagnose an individual with this condition. However, in a low-resource setting like Ghana, you often find a neurologist in a tertiary hospital and well-equipped private institutions. However, when you bring your loved one or family member to our clinic or hospitals, a general practitioner can diagnose the condition based on physical assessments and medical history of the person that you brought. Mostly, we do some laboratory investigation to rule out certain conditions that mimic Parkinson's disease, such as the multiple system atrophy, etc. However, you can diagnose Parkinson's disease without taking any lab investigation. So the blood test, the computer tomography, popularly known as CT scan, the MRIs, and the positron emission tomography that we do for people that come to the hospital with symptoms like Parkinson's disease. We often do them to rule out certain conditions that mimic Parkinson's disease. However, Parkinson's disease can be diagnosed based on your physical assessment and medical history. How do we manage Parkinson's disease? As I previously said, there are two major drugs that have been proven to effectively manage Parkinson's disease, the levodopa and the carbidopa. What levodopa does is it acts as your chemical messenger, that's the dopamine. It's able to send signals to your muscles to move. It's able to activate and stimulate your brain to work, just as your normal brain cells produce dopamine. But we give the carbidopa to regulate the work of the levodopa because it has major side effects that can affect the individual. So we combine the two drugs so that we can get efficient or effective treatment for the person living with Parkinson's disease. We also have surgery. What we do for individuals, but surgery is rarely done. We don't really do it often among people living with Parkinson's disease. What the surgery involves is an implant is stimulated into a device is fixed into your head and is able to stimulate your brain to work as a normal human being's brain work. We also have the occupational therapy. People living with Parkinson's disease struggle in performing activities of daily living, such as bathing, cooking, etc. So what your occupational therapist does is they take you through certain activities that will assist you to live independently as much as possible. Also, we have some movable objects or equipment such as the walking sticks, wheelchairs, etc. You go through this therapy and then you know which equipment suits you best to be able to live an independent life as much as possible. And then we have the physiotherapy, the massage, and the yoga. We normally do the yoga to improve the flexibility of your muscles. And then we massage you to release the tension that occurs in your muscles. So what are some of the preventive measures that one can take to reduce his or her risks in getting Parkinson's disease? Unfortunately, Parkinson's disease do not have cure. And then It's very, very difficult to say you are preventing the disease from occurring. However, if you are a farmer and you often use pesticide on your crops, you try as much as possible to wear protective clothing. If you are a welder and you are always welding your metals, etc., you stand at a higher risk of getting it. So ideally, please be in your protective gears when you are welding your metals. People living in air polluted areas, it's very common to find air pollution in Ghana here. Try as much as possible to use nose mask or face mask as popularly called. If you are frequently exposed to toxins, you may stand at a higher risk of getting Parkinson's disease. What can we do to help people living with Parkinson's disease? Support. Let's try as much as possible to support people living with this condition. It's very challenging to have this condition and be living alone. So if you have a friend, a relative or family that has or exhibited this condition, what we can tell you now is if you are able to bring your relative to the hospital on time, we are able to manage their symptoms earlier for them to be able to live a normal life. Do not wait till the disease progresses to the last stage of it before you bring your friend, relative, or family to the hospital. Also, Parkinson's disease is not a spiritual condition. You don't need to take your relative or friend to a spiritualist or herbalist for management. No, you are doing harm to your relative than good. The earliest you can bring them to the hospital, the faster they get the care that they need to be able to live a comfortable life. And our dear health workers, let's educate ourselves on the condition and let's educate the public on the condition that Parkinson's disease is not contagious. You cannot get it by coming into contact with a person who has it. Although we see some symptoms that mimic some contagious diseases like meningitis, we see the drooling that comes from their mouth, etc. It is not contagious. Let's draw them closer, support them with their daily activities as much as we can. Thank you for watching us. See you on the next episode. Bye. Thank you for watching. Please like, share, and comment. And please don't forget to subscribe on our YouTube channel at Healthcare Hub 233. Bye.